Hi, everyone. Welcome back to The Spark. My name is Jessica McCarthy. I'm the Senior Vice President of Lumiata, and I'm joined today by Julie White, who is the Senior Account Executive at Lumiata. And we're talking today about embracing AI. How, as an individual, an organization, whether you're a payer or provider, whether you're a self-insured employer, whether you're a patient, how do you embrace AI? It's not easy. And there's a lot that goes into making sure that you're ready as an organization to look at what AI can offer and think about the best way to fold that into your organization in a really productive, actionable way. So Julie and I have been talking about this a lot, and we wanted to share the conversation we've been having with all of you. Welcome, Julie. It's great to have you on The Spark.
Nice to see you. Nice to be here. Yeah, on such a great topic. It's very interesting to be part of this discussion as it relates to AI and organizations really embracing it. I would say the biggest thing probably is to start small. Obviously, things in healthcare are somewhat crazy right now after this pandemic, and we're still in the midst of it. But I think what AI brings to healthcare is amazing, and the fact that we can now predict a lot of things when it comes to whether it's care and making lives better, and also assisting folks in whether it's high cost claims. And how do we get to those patients quicker and faster and making this world a little bit of a better place? So I'm very excited about what AI brings to the market.
Yeah, I agree with you. And you brought up the most important point, right? How do we improve patient care? And I think that's why we're all in this game. And that's certainly why Lumiata is in it. Let's start a little bit. You and I talk about this all the time. What does it mean to embrace something? What does it mean to really welcome it into your environment? We've talked about the number one thing it takes is passion. And it's not just passion for doing the AI. We see that in our data scientists and our engineers every day. It's actually passion for what it can do for every kind of organization, right? So let's break it down a little bit. When we talk about what it can do, there's on the payer side, right? So we see with our customers that AI can identify high cost claims, high cost claimants, high cost members, high cost events, both chronic and acute, right? Ones that are expected and unexpected. And when we talk about AI, I hate to use AI and ML because there's such technical terms and there's so much buzz around them. And for a lot of people, it really just, they glaze over and they shut down.
Agreed.
What it really is predictions, right? It's we are helping our customers predict the future. We're helping them see what's coming down the path. As you talk with our customers, both on the ALR side of the business, where we're predicting high cost claims so that payers can price their business better, or when you're talking on the care management side and helping chief medical officers, care management teams, providers get in front of care for patients, get in front of issues for patients so that we can care for them better. What do you hear from our customers? What is it that they need to be able to think about and really get the rest of the organization motivated around to embrace this idea that we can predict the future?
Well, I think the biggest thing is obviously they're very excited about getting those predictions faster. So a lot of companies right now have the data, but the data somewhat is in a fragmented section. So we actually can take just 6 columns of that data and give really good predictions in a quick manner. I think up to this point, the industry has waited months to get those predictions. So how do you help anybody if it takes you months to get ahead of that? So with Lumiata's Prism product, we actually can actually get to those predictions in a minutes versus months, which I think is revolutionary. And what's very exciting to our customers is and those care management folks, because a lot of those, are medical folks and they have that passion to help out those patients. So getting those results quicker and faster means that you can actually make an impact on that person's health quicker and faster versus waiting around for that data come back and actually give you those predictions. So I think that's kind of the crux of that passion, if you will, is making an impact on those patients. You'll see it a lot in doctors and nurses' faces that they are very loving individuals. And I think the results that Lumiata brings to those professionals to make an impact, just it's really, I always say it, and I say it, it's kind of being part of the cool kid table, is that you can impact something that is so revolutionary that if we can give you those results quicker and faster, then you're enabling some really interesting things on the backside.
Mm-hmm, mm-hmm. So I'm hearing a couple of things that I think is really interesting. It's again, that passion, the desire to really care for patients in a much more proactive way. I'm also hearing that there are these opportunities to really make things easier. And I think one of the big fears among providers is that AI or machine learning or predictions are trying to replace them, or to say that the human intervention isn't necessary. We actually believe the exact opposite, that our predictions are merely data. It's information. It's what you do with that information that's most valuable. We can predict the onset of diabetes in the next 12 months. We can tell you why that patient is going to be thrown into that diabetic category. We can tell you what claim will be the reason they're thrown into that diabetic category. We can tell you when that's going to happen. But what you do about it really depends on what that individual patient needs in terms of care and intervention. And as we know, every patient is different.
Correct. And I agree with you. There's been some of that fear of what AI is going to do. And really what it does is just gives you another resource as either a payer or provider. And as we see more of the payers and the providers getting into value-based care, that throughput is always going from the patient through the provider to the payer. And they're working together by having more information and more of a fuller picture of what is happening to that patient. The care only gets better and the payments only get better, so that it is making it more streamlined. And if anything needs to be more streamlined right now, it's healthcare. And that's what we're hoping to bring at Lumiata is with more information, you're able to make better predictions of what is going to be happening with that patient, what their medical billing is going to be in the future. How do we stop that billing by getting to that patient so that maybe they don't get diabetes, or that we correct it before it becomes something worse for that individual. So it's just getting ahead of that trend is what is exciting about what AI and even machine learning or ML brings to the plate. So it's just human nature is that we all fear change. And so I think my suggestion about this particular topic is learn about it, take an interest in it, and don't think that you have to boil the ocean in order to be good at it. Start with, as we kind of said before, start small.
Right.
Maybe it's a smaller population that you want to, try it out on and see what the results are.
Yeah, I love that idea of starting small. We've actually talked about it on this podcast before, that it never works to try and boil the ocean or solve all your problems. And inevitably that leads to cycles and cycles and cycles and ultimate, failure. That the idea that you can start with a very specific, very small use case really does help. What are some of the examples you talk to your customers about? What use cases do you see them embracing and being able to start with to really build that predictive muscle?
Yeah, it could be, a population that is maybe your high cost population. How do we, whether it's, it could be your diabetes or asthma or COPD, that kind of population, how, taking a look at them and figuring out predictive in the next 12 months where that population is going to be going. And again, I want to reiterate the fact that many times that data um, is within these organizations, but they can't get to it, or they don't get the results back for months. And what Lumiata's Prism solution can do is get that in a matter of minutes versus months, so that they can make those predictions and take a look at it. So I would probably coach an individual company to take a look at where is the problem and pain right now, and let's take a look at that patient and population first before we go boiling the ocean. So maybe it's if you're talking to a payer, it's a certain population or a membership group that we do, just maybe it's a pilot that we just take a look at, 1,000 members and see what the results are. And then if you want to take a look at a bigger population, we do that. But at least it gives you a place to start. And that's where we'll take the fear out of that by having just a place to start, not doing the whole roadshow.
Yeah. So it's interesting. I love that idea of taking a small population, even a population as small as 1,000 members, and
Mm-hmm.
running that through our PRISM model as an example to see what kind of disease trends are we seeing within that population, and what are we going to do about it, right? The actionable nature of the predictions has to be addressed as you get these predictions, because what you can't do is get them and do nothing with them.
Correct.
That has no ROI. That doesn't
No,
get you any kind of solution.
no.
So one of the things I know that we're looking at, and I'd love to get your thoughts on this, is we're looking for partnerships that we can bring to our customers to help them think about how to incorporate these predictions into their existing workflows so they don't have to change what they're doing, that they can find
Correct.
a way to integrate it. So one of these, an example of this is if you're currently using, say, Tableau, and you're
Mm-hmm.
using that for your BI tool, Lumiata will integrate with Tableau and push the predictions right into that solution so that you don't have to log on to another platform. You don't have to look for those solutions elsewhere. They can be seamlessly integrated into where your business teams are already looking to try and identify additional opportunities to save costs. I know, Julie, you've also been working with some of our partners more on the consulting side. Do you want to talk a little bit about that?
Yeah, and you bring up a good point. A lot of, some of the fear of any organization that's going to adopt a new technology is, great. This is another thing that we're going to have to learn. And how do I ramp up my
Yeah.
organization to,
No one wants to buy another technology.
nobody wants to, and that's the true fear of it. It can all sound great on the front end, but then implementing it can be a nightmare on the back end. And then how do I also rally my troops to embrace it so that they're actually using the results that Lumiata finds? So, as you had said before, is that we are very much looking for partners that can help organizations with those workflows, so that it once you get the results, they're actionable, but your organization can take the action. We've already got everybody ready to take those results and to run with them, so that we can impact that patient care or impact those high cost claims. So. And that's really what
Yeah. And I think we even have a product ready to go that is sort of a services consulting product to help customers integrate the predictions that we are providing into their workflows so that they
Correct.
don't necessarily have to change what they're doing. It becomes additive and incremental to what they're doing, accretive to what they're doing, so that it just makes them more powerful. It doesn't actually
Yeah.
interfere with their business.
Yeah. Yeah. And that's the biggest thing I think that the organizations that I'm speaking with really like is that it's another tool that they can add already into processes that they already have established. So it's not like we are asking them to recreate the wheel. Let's take what's working and make it better, basically.
Yep. The other thing that we've seen, which I appreciate from our customers, is they're going to their existing relationships, whether those be outsourced care management, whether that be outsourced acute care or ambulatory care centers. They're going and saying, can you add predictive capabilities to what you're already offering? And that's also something that we are very focused on, is working with other services and SaaS companies that are helping the healthcare industry to add predictive capabilities to what they're already doing for their customers. And I think we're seeing a lot of interest there. And as you and I have talked about many, many times before, at some point, everyone's going to need to be able to sort of come together to offer all of these services. And right now, there's still a lot of point solutions. So how do you, as someone who's looking to integrate artificial intelligence, machine learning, or predictions into your business, request that of your existing vendors or relationships? So that's another way that Lumiata is working to bring these predictions easily into the environment that already exist for payers, providers, and other services companies.
Correct. Yeah. I mean, it's really on, I think, precipice of really providing care that is proactive, but rather than reactive. And if you can get ahead of it, then, you can solve some of those problems. And it is, really the science that with AI and ML that we've been able to do it. So that's where I'm excited to be part of Lumiata and talking to these clients of how do we push healthcare forward so that it's not just patients coming to you with a problem. How do we predict so that we get ahead of it before it happens?
Exactly. So, in sort of summary, I'm hearing a number of things from both of us. Let's recap for our audience.
Yeah.
We're sort of saying, look, in order to embrace AI, you've got to be passionate about it. So learn about it, understand what it can do for you, and figure out a way that it can be easy for you to use, that it's going to be valuable, provide you with actionable insights that you can incorporate into workflows you already have. And ultimately reduces the risk for your organization, gives you the ability to save money, and most importantly, helps you improve care for patients.
Correct. Yeah.
And I'm hearing also, start small. Don't try and boil the ocean. Look for opportunities where you're embracing it in a way that makes it easy and adoptable. And Julie, you mentioned Prism. Do you want to put a plug in there for Prism?
Yeah. Well, and right now, what we are offering to qualified customers is the ability to have a Prism pilot. Where we do take, a membership of about 1,000 and really take that data. So it's about 6 columns of data, not a lot that we're asking from those qualified customers to take a look at what the predictions would be on those populations. And once we have that data, we can predict those outcomes in a matter of minutes instead of the months. So literally, in under 20 minutes, we can give you an idea of what those predictions would be for those 1,000 patients. So I would love to have anybody that's interested in taking a peek at what those, maybe that population of diabetes or, asthma, some of those individuals that you're truly worried about. We can take a look at it, give you an idea of, can you imagine what this would do for the entire population of who you're trying to take care of? But again, I want to remove the fear. Let's just start small. Let's see what we get, and then we'll go from there. So yeah. So anybody that would be interested in taking a look at our prison solution, I'm more than happy to have a conversation with, and would love to help you embrace AI as being a solution that can move your organization forward.
Yeah. And I will, I'm going to read this quote. There was a blog that was posted on LinkedIn recently, and the blogger wrote, health systems that haven't embraced clinical AI are missing out on tools that can save lives. It's time to take the next step and add a clinical AI platform to your 2022 strategy to provide safe, high quality, more sustainable care in a cost efficient way. I think that's exactly what Prism does.
It does. It
Yeah.
does. No.
Yeah. Well, I love this conversation, Julie. I'm so glad that we got a chance to bring this to our audience. I know you and I talk about this all the time, and, you know,
We do.
Our customers who are struggling how to figure this out. And for any of you out there that are interested in having a conversation or are interested in just learning more about how AI and ML and predictive analytics can impact your business, please reach out to Lumiata. We'd love to speak with you. Thank you for joining us today.
Thank you.